I'm Dr. David Hill, and today we're going to be talking about how to get rid of a clogged up nose. Now, to answer that question, you have to ask, why is the nose clogged up in the first place? In some cases, it's something pretty obvious, like a foreign body in the nose. I recently had to help remove a bead from my 4-year-old's nose, so that's pretty straightforward, but it does help to look up the nose and see if there's something in there. A very common reason for a stuffed up nose, especially in the spring and fall, is allergies, or what we call allergic rhinitis. Now, the hallmark of allergies is itching. So you'll often have a lot of itching of the nose, itching of the eyes, watery drainage from the nose and eyes, lots of sneezing, congestion. There are medicines that you can get over the counter to treat allergies. Cetirizine or Zyrtec is one. Loratadine or Claritin is another one. And there are various generic forms of all of those. The Loratadine is a little less sedating, but different antihistamines work better or worse for different people. So just because one didn't work doesn't mean the other won't be helpful. Your doctor can prescribe some more powerful medicines, usually in the form of a steroid nasal spray that you squirt up the nose once a day. These sprays don't work quickly. They take several days to kick in, so you don't want to get too impatient if you've started one of these. Now, another common reason to have a stuffed up nose is a cold, a viral rhinosinusitis, we call it, just a viral infection of the nose and sinuses. And the best way to unclog that, especially in babies and children, is to use a little bit of nasal saline drops. Now, you can make this up with a half teaspoon of salt and a cup of water in your own house, or you can buy a commercial preparation. For babies, you drop a couple of drops into the nose and then use that little blue or red suction bulb you got from the hospital or the drugstore and go straight back just a couple of millimeters really into the nose and suck that stuff out, and that'll give them some relief. For larger kids and adults, you can achieve a similar effect with an instrument called a Neti Pot that is hundreds or thousands of years old and commonly used in Eastern or Ayurvedic medicine. There are also over-the-counter decongestant sprays that you can buy along the lines of Afrin, but you want to be really careful with these sprays. You never want to use them more than 2 or 3 days in a row, because after you've been using them for a while, the nose gets used to them, and when you try to stop using them, swells right back up. So make a hash mark on the bottle or keep a calendar, and know that if you've gotten to 2 or 3 days of use, it's time to stop it. And honestly, if your nose is still clogged up that long, you probably need to see your doctor. Now, there are some alarming signs. If you develop a fever over about 102 degrees, or the runny nose goes on more than 10 to 14 days, or if you have a fever that lasts more than 4 days or goes away and then comes back greater than 24 hours later, those are all reasons to suspect a bacterial infection of the sinuses, and you really ought to see your doctor for those. Talking about how to clear up a clogged up nose, I am Dr. David Hill.